most of you we know, and I actually feel like I'm getting together with old friends because of the time we spent talking and learning about your program. So I'm thrilled that so many people are interested. We're expecting quite a few more, but I think they'll just watch the recording to learn about the evaluation project. So I think we'll just get started. You all have busy days.
You know, it would be lovely if you're brave enough to show your faces. This is Cassandra Furman with Arch. And if you're brave enough to show your faces, that's always fun. But I understand why some of you are hesitant. I usually am. Ah, yay. We know those people. Hi. Hi, Amy.
Oh, sorry, I'm having a little bit of trouble here.
Okay. Are you sharing your screen, Susan?
Yeah, but I can't find my slide. Oh, here we go. There we go.
Okay.
Okay. Can everyone see those slides? Okay. I'm Susan Summers with Arch, and my colleague Cassandra Furman in red is with Arch, and one of us or both of us have spoken with all of you, or with most of you, during the interview process for recognition of innovative and exemplary programs. So if you're on this call, it means that your program has already been recognized by Arch as innovative and exemplary. There have been some staff changes in programs, so some of you we may not know because you weren't part of the program or weren't part of the interview at the time. But as long as your program has been recognized as innovative and exemplary, you're eligible for funding, and we're thrilled that you're here. So everybody knows what Arch is, I think, who's on this call. But just to remind you where we fit in with Arch, where innovative and exemplary respite programs fit in this first bullet, training and technical assistance division. One of the things that we want to do, and we'll review this briefly, is advance evaluation and research. And because we don't have a good evidence-based repository for respite programs and services, we really didn't, at the start of this 5 years ago, we really didn't know exactly what was out there and what people were doing. So you've been instrumental in educating us at Arch and the whole respite network. And for that, we are more grateful than you will know. So the Innovative and Exemplary Respite initiative started about 5 years ago. And this is just an extenuation of those beginning efforts to recognize programs. So this evaluation mini grant project is something that we've thought about since the beginning. Some of you may remember when we interviewed you, we always asked this question at the end after we went through our criteria for selection. What do you wish you knew about your program that you don't know? What would you like to learn about? And we were just kind of bowled over at the thoughtful, intelligent questions people had and wished they knew how to measure. And we started describing your programs as research ready. Some of the programs have actually done evaluation and even have published in refereed journals, but that's not the majority of programs. So all the programs will meet the criteria that we're going to go over, but some need some assistance in evaluation, and some we believe would be wonderful resources for other programs. So, you know, before I go further, I just want to let you know that one of the ways we think about this project is that we would provide technical assistance and resources to you, lots of different kinds of resources, bring people in to teach us all. But we also want to learn from you and with you. So just so you know, this isn't a top-down enterprise at all. We think there's so much to learn from one another, and that's the spirit of this project. So we want to know, we want to identify evaluation measures and processes that show the effectiveness of respite services in improving family caregiver wellness. There are so many things you can measure, but this is the one thing that we think is absolutely essential for evaluation of respite programs. And it's supported by many other things you can measure, like training and matching and different things, but we want to show caregiver wellness. And this also jives with the work of another initiative that ARCH is involved with, and that's the Agenda to Advance Respite Research. And there's a national committee that looks at that. And one of the things they're interested in is measuring caregiver wellness. So we map onto their activities and complement their activities. So we want to identify the exact evaluation measures and process that show the effectiveness of other elements that support either directly or indirectly caregiver wellness, such as person-centered services, staff and volunteer, training and support, etc. And then we want to identify measures and processes that help respite programs make decisions day to day. So one of the things that we saw in programs that we thought sounded really excellent is they would do like a satisfaction measure at the end. But they didn't really capture all the wonderful things that they were doing. And they didn't necessarily collect data ongoing to know whether they were on track. Some programs did a great job at this, others less, but we'd like to start to like firm that up and be able to understand what works well and how we can share that. We want to show the merit of respite to stakeholders and funders. And then if we can, create an evaluation model that other respite programs can look at and learn from. So pretty lofty goals. And just to remember, just to think back to the original initiative, the recognition of your programs is we want to identify and document promising practices, learn more about respite practices that are evidence-based or informed, learn ways to address challenging aspects of respite, and last but not least, just honor the work that you do. So these are the 7 criteria. And Cassandra, jump in with me if you have any observations about this, but I don't know if you were aware when we were interviewing you and when we gave you the application was kind of organized in this way, but these are the things that we believe are important for every program to have. And if you're on this call, you demonstrated that you did all these things, some to a greater and some to a lesser degree, but you had all of these elements there. We recognize some programs as rising stars or innovative, but not innovative and exemplary. And they had some or most of these, but not all of them. But so you're already really strong. We know that, and that's why we want to learn from you going forward. And you might think about these criteria if you decide to apply for a mini grant. You might want to refer back to these in your application. And then again, the focus on caregiver wellness comes from the original research agenda, focusing on respite as resulting in some benefit to the caregiver. And the reason this came up, and this research, the original group that came up with this definition of respite really struggled with it, because so many respite programs and some that applied for recognition focused more on the care recipient than the caregiver. And of course you want to focus on the care recipient, because how's the caregiver going to have a good experience, right, if the care recipient doesn't? But we always want to show the benefit to the caregiver. So it's pretty simple and straightforward, but actually programs sort of struggle with this one.
And also we're lacking enough information, really good outcome data on the effects of respite on the caregiver. There's seems to be a lot of focus on care recipients, and like Susan said, we agree with that. But we really do need to focus on the caregiver, the parent, the spouse, the child who's caring for a loved one. So important.
Yeah, thanks, Cassandra. Okay, so the purposes of this mini grant project are to describe exactly what we mean when we say we're providing respite to caregivers. And this seems like so straightforward, right? Like, what are we doing? But at the research consortium a couple of years ago, one of the things that came up is that we don't really know, when people say they're giving respite, we don't know what it looks like from program to program and what's contained in that. And you can't really know what you're measuring if you don't know what you're doing. Just another thing, Cassandra, I don't know if you had this experience, but when I remember interviewing people and just being so impressed about their skill and sensitivity and how they could speak to each one of those 7 criteria. But the knowledge seemed to lie with that person I was interviewing. And if you looked at like program documents for training others or fidelity, there was a big discrepancy between the person interviewed, the person in charge, and documentation of what everybody in the program was doing. So you never really knew if it, were the other people as qualified, were they adherent to the model. So we want to be able to start to document that. We want to describe what we mean by caregiver wellness and quality of life. We probably each have 10 different things we think about, but we may not systematically ask caregivers what those terms mean to them. Some of you do, and when you do, we want to know how you do that and how all programs can do that. Another reason to do that is to generate working hypotheses and theories of change. So what we've also noticed is that programs definitely have this in their mind. They know what they're doing and why, but they don't have it on paper, and it's not measurable. And then we just want to document what we do, what the actions we take, the dose that we offer, those sorts of things, and so that we can measure the process of change and fidelity, and to measure changes in outcomes and caregiver wellness. So I see these kind of like first 5 as prerequisite to that last, being able to measure caregiver wellness and know that it's what we're doing that makes a difference in caregiver wellness, and know when it's not working, what we can do to tweak it. Okay, so here's the black box that I was talking about that came up in the research summit. I used to work in early childhood special education, and the big thing then was home visits, and everybody was doing home visits, but nobody said like what happened during the home visit. So I think about this in the same way. So I had this list actually on a screen, and it was too big, but I'm just going to quickly give you some idea of the things that we heard when we interviewed you. Your programs do intake assessments, initial interviews. Some of you do matching, language, cultural background, interest, skills, schedules, relationship building, really explicitly provider and caregiver and care recipient and family. And some of you do caregiver to caregiver activities, support group, social emotional well-being. Some use time use coaching. A number of programs do that, but don't actually know what time use coaching is, but they just have figured it out kind of intuitively. The core skills training, the kind of thing that Arch is doing with Wisconsin to make sure that every respite volunteer provider has basic respite provider skills. And then there's skilled service provision if you have a specific population that needs special skills. More programs are using technology, particularly after COVID, and now it's a big part of their program. There's mental health, child focused, mental health, caregiver focused, social emotional health, sibling focused, caregiver training, caregiver goal setting and monitoring, and then the program models, in-home, community-based, activity-based. And then
there's so many. I'm just thinking
and all those are in the black box. And when they're not accounted for, how can you know that which parts of those are essential? How can people do what you're doing? And how do you know it makes a difference? So it's messy. Okay, so for your application, you do not need to design the evaluation in advance. Some of you have evaluations, and that's great. Some of you just want to add on, refine them, go more deeply, that's absolutely great. We want you just to demonstrate that you're curious about your own work. So when we ask those questions, like, what do you wish you know? And we got such great answers from you. That's what we were looking for. We need you to point out areas related to caregiver wellness that you'd like to investigate in the context of the work that you're doing. And you need to show that you understand the basics of evaluation. And I mean really basic, because people can, grantees could come in at really different levels, and we're fine with that. That doesn't matter to us.
And
It's more
also,
that they
Susan, I wanted to
Please.
mention that some people are, earlier on, you were talking about the different levels of evaluation that people were doing. I
Mhm.
found that many people are doing evaluation, but they don't know it, and they're
Mhm.
not calling it that.
Mhm.
So they're collecting data on demographics, for example, and tracking changes in demographics, and basically they're doing a level of evaluation.
Yeah.
So probably, even though you may not think you know the basics, no one would be in this group today if they didn't.
Right. Yes. Another example of that, a couple different programs do this, is they keep a running log of important things that they learn during conversations with caregivers, and they review those and follow up on them. That's
Yeah.
that's the best of program monitoring right there, but they didn't see it as evaluation. So
Yeah, they say, well, we have case notes,
case
and
notes.
the case notes information, that's data.
Yeah.
Of course, depending on what you do with it makes a difference, but all of you are doing evaluation.
So this is the review and selection criteria. We want to see that your proposed evaluation questions are relevant to your respite model, and that they correspond to your current evaluation efforts and the innovative and exemplary recognition criteria. And we can post these slides for you so you can go back to those if you don't remember. I'm also going to remind you of my email, so you can call me. I mean, you can message me, or we can set up, if you want to ask me questions personally, we can arrange a call just to kind of go over those criteria, if that's helpful to you. And then the clarity, logic, and soundness of your current evaluation efforts and proposed evaluation questions. And if you feel like your plan is like not sound in some ways, that would not count against you if you recognize like this is not getting us what we need, and you recognize when it's not working. That's part of sound thinking. We're looking for clarity and coherence in your application, and organizational strength and commitment. This is going to be really important, because it's not a huge amount of money, and it's going to be monthly meetings where we all kind of work together, and we'll figure out as a group how long those meetings should last and how they'll be constructed. But it's really is going to take some commitment on your part. So, and I want to remind you about the federal match equaling 33% of the award, and that can be volunteer hours, that can be money from other than federal sources. But that's something that we're looking for. And then the broad program interest, if it's like only you, nobody in your program wants to collect the data, or like, that's, just think about that ahead of time, whether or not you have a team that's also interested. And we welcome, for people that are awarded a grant, we welcome teams to join the calls, based on what works for you. So again, it will be constructed by this evaluation group, the monthly meetings, and we'll try and be really responsive to your individual program needs. So what we want from you is to design and implement a new evaluation plan. Now, remember, this sounds huge, but remember, we're looking at caregiver wellness. So you don't have to do a program-wide huge evaluation plan. We need to accomplish it within 12 months. There may be a possibility of a no-cost extension. We'd like you to attend monthly meetings and support colleagues, both within your program and in the group, in your work. Focus on caregiver wellness and quality of life. Allocate resources in your program to collect data and share data using the processes and tools that you identify in your plan. And then instead of a final report, we'd like you to do an evaluation brief that you can use. That's not just an extra thing that you have to do. And your work will all lead to that brief. So you can share data within your program, with a network at large, with funders and stakeholders. And then we always ask, because if you think back to our purpose is to strengthen the respite system. That's our kind of overriding purpose. And I have to say, the innovative and exemplary programs have been so generous with webinars, national presentations, international presentations, just sharing information about their programs with the Break Exchange newsletter. So we'll make an ask of you, and of course, you can choose what format you would like to share information, but we would ask grantees to share information with the larger network. It doesn't matter which populations you serve, which interventions you use, as long as they logically link to caregiver wellness. And again, remember that can be really supportive things like training, like, having a well-trained staff, and in a way that you believe, your working hypothesis believes that makes sense to support caregiver wellness. What we really care is about how curious you are about your work, your willingness to understand how your work affects families, that you can engage in a learning community, and how feasible it is to conduct an evaluation in your program, and how willing you are to share with a wider respite network.
Susan, this is Jill. Can I just add a clarifying piece on when you go back? Can you go back one slide?
Yes.
And where it says it doesn't matter which interventions you use, I would like to clarify, and Susan, tell me if I'm wrong. We're still talking about your respite service that you're evaluating.
Sorry,
not
that's
another component of a caregiver support that you're providing. This does have to be linked to the respite services you're offering.
And that language, I remember when I wrote that, sorry, that's 40 years of early childhood special education training and teaching and service. So that's not the right word. It's the service approach that you use. So that's what we're thinking.
It could be overnight, it could be camp, it could be weekend, it could be a variety, provided it's respite.
Yes. And it can be a matching process. It can be an initial interview process that helps set up a relationship that's fruitful and checking in. So it's defining what's in the black box according to your theory of change, what you think you do that results in a positive change, beneficial change for caregivers. So that's what we're thinking. Unmute yourself and just share your thoughts about this whole initiative and why it's of interest to you. Just feel free, anyone, to say what's on your mind and ask questions.
Hi there. So Park Center for Disabilities. Hi. Oh, I'm not on there any longer. Haley Berry, Whitney Stout, Brady Gautier. So I have a question. We have an assessment that we developed internally, specific to our program, and we track the data. We have an assessment specific to caregiver wellness, as well as each family member development, a bunch of things on that. How would we be able to utilize this to kind of refine that type of information? Is there like a clinician that we would be specifically working with in meetings, or research that we would be able to utilize this with, or some sort of way to validate the tool? I'm just trying to find out exactly what our next step would be in this process.
So that's a big question. So one of the things that we like programs to do is to use reliable, valid measures. So it sounds like in your program, the available measures in the field, and I listed in one of my earlier slides, I put up a slide that talked about the Benjamin Rose Foundation, and they did a document. It's now 10 years old, but they talked about all the conceptual categories related to caregiver wellness. They had 6 different categories, and there are numerous measures within those, but they may not map onto what you're doing. I mean, that's what I'm guessing why you developed an instrument for your own program. Am I getting that right? That you just couldn't find something that fit your needs?
Yeah, so I don't know if it was just what was available. Maybe we just didn't have access to as many different types of materials as others. But what we had found for our specific population, there was not a tool out there that matched.
Yeah.
We developed something that works fantastic and is able to collect the information that we need. I'm just trying to find out, I guess, kind of if we were to participate in this, how it could help us really refine and move forward, and how it would really support what we've already done, or if this might be something that we internally have already developed and maybe we just work side by side as opposed to like getting support from your end.
May I take a stab at this?
Yes, I was just going to call on you.
Well, there are a couple of things. Quite often people have in the past developed, for example, their own Likert scales. And we actually encouraged it many years ago, many years ago, but that scale development and testing is a science in its own. And so now that we have more in the field that are available, we would love to help you find out if we can match a tool that really does go along and link to the black box of your respite program. So we could help you do that. There are some tools that it makes perfect sense for you to develop on your own, things like checklists, things like tally sheets, attendance records. So there are some things that, of course, you can develop on your own. It's when you get into the world of surveys and Likert scaling sorts of tools that we would prefer that you use something that has been validated and found reliable. But we could help you find those.
Right.
But there are other things, such as case notes, tally sheets, checklists, that it makes perfect sense. Those do not need to be scientifically tested, but there needs to be some rigor in their development and use. But I don't know if I answered that.
I think
Go ahead.
I think it also depends on how you're going to use the measures. So I'm thinking all the way back to Cassandra and I both did graduate work at University of Oregon. And one of the things we were doing is developing a developmental screening for young children. It was the Ages and Stages questionnaire. And it's now the most widely used developmental screening in the world. At the time, we were working to develop it and collecting data. Now, I was collecting data on children at actually a local respite program, and I was so enamored with the program that during my graduate work, I took a position as program director. And Cassandra and I worked together on that respite program in the 1980s. And one of the things that we noticed at the time, many of the families were in really difficult life circumstances. And we didn't really have a handle on what the circumstances were and what risks they faced in their lives, what resilience they had. And there were no measures at that time. So I developed a checklist like that I did at intake, and I didn't go through the checklist with families, but I just said, some of our families are struggling with these things, and this is what we have to offer. Does this sound like it would be useful to you? And then the families would offer, and I'd be able to check off. And then the way I use those data is like sometimes really practical ways to get them resources they needed, sometimes to get funding for the program. These are the circumstances. All the data, of course, was private. So that was a really useful checklist to me to know what was going on. It wasn't a valid and reliable measure. Cassandra, years later, developed, what's the name of the instrument, Cassandra, that you and Ray worked on with the University of Kansas?
The protective factor survey.
Protective factors. So some of, after years of funding and many years of research, it's a valid and reliable instrument now. But portions of it were useful, really useful to me at a time in that form. So it's, it is a long conversation. This is the kind of conversation we would have in the research group. Is it worthwhile to you? How much can you trust it? Is there something else out there that if maybe that is reliable and valid, doesn't address all the areas you want to measure? How can we use more than one instrument together to understand what's going on? So it's a kind of difficult question, but it's exactly the kind of question we would love for you to bring to a group to kind of puzzle through. When do you absolutely need to use a reliable, valid measure? What are other ways to capture what's going on in your program?
And I just have one last question. So if we were to continue forward and we decided that we wanted to refine what we were currently doing, could this financial opportunity end up eventually possibly validating the assessment that we're currently using? Or is that not something that we're looking towards with this specific opportunity? Well,
I'll answer it this way. When we were developing instruments at Oregon, we had year after year of federal grant funding, well over $100,000. I mean, we did like a whole national study. So it can be a really big, labor-intensive endeavor to establish reliability and validity. This amount of money won't get you there, but it will get you colleagues to help examine like what's working, what's not working, what's the way forward, how much trust can you put into this? So I don't know if I answered that well. Cassandra, did that answer make sense to you?
Yeah. If you haven't selected tools yet, that's okay. You can still apply. That is part of this process.
Right.
This process is if the grantees who are selected to receive these awards will work with us. If you already have tools you've identified that you're using, that's good. If you're not sure what you're going to use, and you still have a really clear idea of what you want to measure, and you are committed to collecting data, we can work with you and help you find the right tool for measuring the outcomes you're looking for. I think that's our best bet. And, Susan, I'm just going to say something really quickly while I've got the floor. Before we end, let's make sure that everyone introduces themselves. We don't have to do it right now. We've got some, go through the question, but I'd sure like to know a little bit about each person on the call. So but we can wait until the questions are answered.
Okay. And I don't know if that really answered. That was a kind of big, complicated question answer, because it's a big, complicated question. But it sounds like the measure you're using, that it's capturing something that you want to capture, and that's great. That's really good. It may not be ready for prime time, like to send it out to the field and say everybody should use that. So you have to make that distinction. What we're kind of hoping is that all the participants in the mini grant project will find some things that they can measure in common and some ways to measure in common. And then also, sorry, there's my loud enough puppy. Then also that you will find some unique measures for your program, because your programs are all different. So, so it's like yeah, I mean, that would be something interesting to bring to the table, what you're using, what you think is working, and have a conversation about how to get from where you are to a point where you know your instrument is reliable and valid and ready to be shared with other people. And sometimes that means making a partnership with a university that has the resources and staff to help you do that. That was a great question.
This is Eric Schmucker from Precious Time.
Hi,
And
Eric.
hi. So going off of that, this is something that we've been really wanting to get into more and very excited about the opportunity to apply for the grant. We'll be applying, but also what I see really exciting about this is not just the money, but also the connection and the support to do so. We've been struggling finding externally valid measures and measurement tools to get at what we're going with. One of the things we found was we're still identifying outcomes that we want to measure, but parental stress is one of them.
Right.
And we found the parental stress index, the PSI, and there's like 4 versions now. One of the things we're running into is this balance between one of the measurement tools is like 118 questions.
Right.
At what point is the assessment more onerous for the family than it's actually worth in providing respite to do? The other thing that we're figuring out, finding too, is that some of these tools are proprietary and very expensive to use.
Right.
And so these are the things that we're trying to navigate when we're looking for tools, is being able to use them financially, but then also that balance of like, can I reasonably ask a caregiver to fill this out?
Right.
So any support, and it doesn't have to be now, maybe a conversation later, or just a link to something, but would really appreciate any support in finding measures that would meet those criteria.
I'm going to send you all a link. The Friends National Center for Community-Based Child Abuse Prevention. Now, we say child abuse prevention, although a lot of the materials are applicable to lifespan. So I'm just letting you know that. We have a compendium of annotated measurement tools, and I'm going to send you the link, and you'll be able to search under respite. Many of them, I will say, are for children, but a lot of them are for the lifespan. But you'll have to sort of sort through that. So if you're serving adults or the elderly, not all of them are going to be appropriate. But there are some tools, and they will tell you whether or not they're in the public domain or if they're inexpensive to use. And many tools, especially if they're developed by universities, will say, you can use this for free as long as you let us know how you're using it. So all you have to do is write and say, we're doing an evaluation project with the Arch National Center, and they will often not only give it to you free, but they might even provide you with some technical support. So I'll get a link ready and send it to the team. In fact, I'll put it in the chat right now.
Yeah. Eric, I have this big fat file on my desktop now, because I've just been every day I'm searching for the kind of instruments that you're talking about, and I found this document by Benjamin Rose Institute and the National Caregiver Alliance with a list of measures, tons of measures, and the same things. And like the Friends website, it's annotated. It talks about reliability, validity, how they measure those, and how much faith you can put in the instruments. And as I said, that one's 10 years old. The Friends website is always up to date, and there may be other things out there. And one resource that we have, or 2 resources, is the advisory board for Arch, and also the Committee for the Advancement of Respite Research. So we can reach out to people that this is their work, they're at universities or policy agencies, and they may know something that we don't know about. So that I see that as one of the jobs of this group, is to find the best that's out there, have these conversations with you who are doing this in your program and saying, like, would this work? Why wouldn't this work? Can we endorse something as a group? I mean, how wonderful would it be if we found a really great instrument that was used across programs, and we could start to communicate across programs about what we're learning and what significance it has for our programs and for the field. So another great question.
Going off of that, I have one more question.
Sure.
What we're hoping, and it sounds like you have the same hope with the purpose of funding all this is, we're hoping to further with this evaluation, not just our program, but respite research in general. And so I guess what we're finding is that there's, and maybe you have more information on this. So the overarching question I have is, where is research lacking? What type of research is lacking? That way, that's also something, if it overlaps with our program, we can focus on. I know there's not a lot of quantitative data that we've found in terms of that. And so we're trying to make sure we're doing a focus, maybe a mixed method study, but mostly a quantitative study.
Right.
But so it'd be just interesting to know like where you see the need is. And, if we would love to hit that if possible, if it overlaps with our modality.
Yeah, and Jill might want to jump in here, but this Committee for Advancement of Respite Research had talked explicitly about those issues. And 2 years ago, I guess it was 2 years ago, almost 3 years ago, there was a summit bringing researchers from around the country and stakeholders to talk about those areas that are most important to pursue right now. And there's a copy of that. We can send a link out of that report on the Arch website, along with the original agenda for the advancement of respite research, which is such an excellent document. I used to teach at university when I actually edited the document, but it was written by Jill and by Ray Kirk. And I thought, I wish I had this when I was teaching students, because it laid out the different phases of research, the different kind of methods and how those map on, the important questions. And I just thought you could just hand this to a doctoral student, and if they couldn't figure out something interesting to study in some way to study, So we do have some of those research resources, the annotated bibliography that Arch puts out about all the relevant research. And then the Break Exchange does a really good job, and so does the Arch newsletter, of citing research resources as we discover them, of published articles. So part of it is just like kind of going through that. And I think looking at the research agenda and the research summit points the way of what as a field we think is important to look at.
And I just wanted to say something, Eric. I think we need, obviously, with the research, because so many programs their funding sources will say, we only want to fund evidence-based programs. And so that's, we want evidence. And one of the things that funders want to know is, are we saving money in the end? They want to know about cost benefit analysis. That's one important area. That's not exactly what this is looking for, although it does play a role in it. So we're looking at, are caregivers better off? And it could be that they're better off because they're able to keep their jobs, because they're able to keep their families out of residential treatment that may be more expensive. So I know that the cost benefit analysis is something we hear a lot about, that people are saying, hey, tell us how that works. We are looking at caregiver wellness, and that can be related to that cost benefit analysis. I know I didn't answer your question directly, especially because we are saying we're looking at caregiver wellness. But I do know that in the funding world, folks especially are very interested in looking at, hey, are we saving money by doing this? We're thinking about saving the humanity of people, the basic human decency. But if you can make that link to cost benefit, that's nice.
Yeah. How about others? What's on your mind? What are you thinking?
Hi, I'm Amy Vega. I am with Vanessa Behan,
Hello.
Eastern Washington. Jennifer Priest is on this call also. She is our grants and stewardship coordinator. And I guess I'm curious a little bit about the funding, if there's any restrictions on how that money is used or any insight on where you see it being best used. As you mentioned, it's not a lot of money that can be used. Can it be used for staff time? Can it be used for purchasing tools, working with maybe a third-party company to help us in some respect? What are your thoughts?
I'm going to hand this one to Jill. Jill, have you given any thought to that?
I think we're very flexible, and we did develop a budget template that made some suggestions about how you can use the funds, but it's not limited to those line items. I mean, if you wanted to hire an outside consultant, and maybe this covers a little bit of the cost of that, or your own staff time that's put toward the work, or the purchase of measurement tools, it's very flexible. I mean, I think we're fairly confident the amount we're giving you may not totally cover the cost of what it is you want to do. So
We know it won't.
yeah. But so we're very flexible in what you apply these dollars to. You might want to use it as if you're going to be interviewing family caregivers, maybe you would provide some stipends or financial incentives. It all depends on what your, final evaluation plan is.
Yeah, that hypothesis theory of change notion needs to come from caregivers. I mean, so yeah, wouldn't that be wonderful to involve them, be able to compensate them and provide them respite while you're interviewing them? And so yeah, being creative would be great.
This is Jennifer with Vanessa Behan, and one of the questions I'm wondering around has to do with, and maybe this is the point of the grant, but when you're referring to caregiver wellness, are you talking about it within a certain period of time? Is it just for that respite situation or respite time, or are you looking for something that measures more a long term and what that would look like?
That's such a great question, but that's exactly the kind of thing that we would grapple with. Like what makes sense to measure? What are the pros and cons of measuring short-term versus long-term? Knowing that, respite's not the only thing going on in the caregiver's life, right? And especially at Vanessa Behan, you've got families in difficult life circumstances, challenging life circumstances. Their situations are changing. So like a pre-post doesn't make any sense for you. Like I mentioned, Cassandra and I, when we worked together, it was at a crisis nursery too. And I remember the surveys that we gave to families and satisfaction, but also just sort of asking about their circumstances. They were private, but I could tell I knew all the families so intimately. I knew who was filling them out. And I just remember a family whose life was completely falling apart. And the survey asked, like, what was their greatest need? And a child protective services worker said, you need to get a dresser for they gave the parent a lot of instructions, but one of the instructions was you need a dresser to hold your child's belongings before they can return home. And so in all this like chaos and of all the things the child protective services worker said, this is what the parent heard and understood. And boy, is that an education for us reading the survey, right? Of like what we need to do to support a parent to understand. And, so it's like, it's a messy measurement. It's just, if you just ask these questions and don't understand context and don't understand change, you can't really make sense of the results. So I love that question. So the question for the group would be like, how do we collect data that shows, that maybe tracks wellness over time, and what are the important contextual factors, extenuating circumstances that influence this over and above just the respite, and how can respite address those to have an amplifying effect of the effectiveness of respite.
And you may, there's a year. We're talking about a 12-month period. There's only so, depending on your frame of reference, that's short or long term. However, I am aware of a program that is looking for money. Unfortunately, respite, they're not doing respite anymore. However, this might be an example. They have collected data and contact information on families they served years ago. They wanted to go back and do a long-term study. They are able to get the records of people who were served in their program 10 years ago. What they are interested in is that they were interested in seeing whether or not the children who were in the program graduated from high school. They were looking at the educational. And so if your program does have contact information and could do something longer term, that might be something you're interested in. Are the caregivers that you served 10 years ago, 5 years ago, wherever, where are they now? And how much did respite play a part of the outcomes they're experiencing now? So we're looking at 12 months, basically in the lives of families, short-term outcomes. However, you may have data, you may have ways of going back and looking at things more longitudinally. Depends on what you've got.
Yeah, and it also realized that in 12 months, it takes a while to get your ducks in a row. So, you know, we want to come to some understanding of what's important to measure and how to measure it. But you're not going to have definitive studies at the end of this. What we hope is that, you know, this sets you on the right path going forward, and that we keep in touch, and that it allows you to enhance what you're doing and understand it more deeply. And when you do that, and share it, the whole network benefits. I mean, how often do we as a group, get to have these conversations about, you know, getting in the weeds with evaluation? There's such important conversations to have, but we don't really have a forum for doing that. So we see that as an opportunity to do that. Oh, I love listening to all of you, you know, what's going on in your programs, what you're thinking. You don't know how excited we used to be when we get off our interviews there for innovative and exemplary recognition after talking.
Susan, I'm looking at the time, and I'm hoping there are more questions, but if they're not, could we do a quick just check in with people, where you're from, and when you received your award? Would that be okay?
That's good with me.
And so Eric, tell us about. I'm looking at my screen. I see you're the first one.
Eric Schmucker, as my name says. The name of the organization is the Claude Moore Precious Time Program. Our primary funder is the Claude Moore Charitable Foundation. We've been around since 2007, officially funded since 2007. We are a university-based respite care program, so we match the university, we're in Harrisonburg, Virginia. The university is James Madison University. So we match James Madison University nursing students. And we do have some other students, special education students that join through an elective class, but with caregivers of children who have disabilities, special needs, special healthcare needs. And they provide respite. It's part of their clinical hours for the semester. Yeah, it's really rewarding. Anyways, bye.
and you listen to our podcast. We
Yes.
include your Precious Time program.
Yes.
Monica, can you tell us about?
Yeah, absolutely. I am Monica Miles. I'm the Director of Programming at Crisis Nursery in Urbana. Stephanie Record and Rachel Graham were with you all during the interview process, and I was on one of them with you. We were awarded last year, I believe 2022. I think it was, yeah, it would have been last year. But yeah, so we provide respite services for families who are experiencing crisis in Champaign County. We are funded through DCFS, DHS, and a lot of private donors as well.
Thank you, Monica. Whitney Park.
Hi, my name is Whitney Stout. I am the manager of Caregiver Relief Services at Park Center for Disabilities in St. Petersburg, Florida. We support families with children with special needs in the Tampa Bay area. We've been doing it for the past 13 years. We were chosen as innovative and exemplary this past year in 2022. We are we receive private funding. We're a private nonprofit, and we are now currently funded by all private donations and grants and stuff.
Thank you, Whitney. And I guess Jennifer and Amy, you can go together because you're from Vanessa.
Hello, yeah, Amy Vega. I am the executive director at Vanessa Behan. We're a crisis nursery in Spokane, Washington. We've been around for 36 years and are privately funded. And I'm trying to remember how long it's been. It was before COVID, so I'm gonna guess 2018, maybe 17, somewhere.
19. I think you were one of the
2019,
first
you were
ones.
you were in the first round. Yeah.
19. Okay, thank you for the reminder. Yeah.
And Jennifer, we've met you. You're with Vanessa. So how about Kelly Allen? And Kelly, we can't hear you, but I see you've gone up. There she is. Hey.
Hi, I'm Kelly Allen. I'm the new program manager for Lifespan's Finger Lakes Caregiver Institute, the Partners in Caring Respite program. And we primarily work with people who are caring for loved ones with memory loss and Alzheimer's disease. Our funding primarily comes from New York State Department of Health. And I've been asked to join this call today, so this is all new for me. But
Okay.
I've
Well,
learned a
welcome.
lot already. Thank you.
Yeah, good. We're glad you're here.
And Natalie? Thank you.
Hi, Natalia.
Natalia.
Yes, thank you. My name is Natalia Calhoun, and I'm the program director at Respite Care in Fort Collins, Colorado. And we have been open since 1982 and serve kiddos with developmental disabilities in a center-based setup, ages 6 weeks to 18 years of age. And I also am not sure if we were awarded, so I'm sorry, I can't share that detail.
I think you were
But I also
2019
let you
also.
know.
I think you were one of the early ones. Yeah.
Okay, thank you.
Welcome.
And Christine?
Hi, good afternoon. I'm Christine McKay. I'm actually the grant writer for Caregiver Volunteers of Central Jersey, but I have held many hats with the organization. I'm not sure, I was looking through our database. I don't believe that we were awarded, but our program director for our Caregiver Respite program forwarded an invitation to apply. So I'm here listening in, trying to learn. I'm also their data manager. So in terms of collecting any kind of research information, that would be in my wheelhouse as well. So this research piece is really exciting for me as a data cruncher, just finding out how to take that more subjective information that we get from our care receivers, that what we call our clients, and how to translate that into meaningful data that funders can look at and appreciate, and as our community as well when we go out and share the information about the program. We get the majority of our funding from the counties that we serve through 3E federal funds. But we do also get some private funding for caregiver respite, and our respite is primarily for Alzheimer's and dementia. But we also have some new programs, new projects that we're bringing into that respite program. We have a music therapy program. We integrate our pet therapy program into respite, and we also have dementia care kits that we're now sharing that can be used as a tool for our volunteers as well as for the caregiver. And we're just now piloting kind of like a rest and recharge, we call it. It's kind of a support group where the caregivers can bring in their loved one with dementia into our office space. We have volunteers that will provide respite so that the caregivers can then have a little time to meet with each other. So that's a new program, and we love to have some data tied into that to really expand that project as well.
Yeah.
Thank you. Thank you.
I just learned about the recharge program yesterday, so I'm really excited
Okay,
to
good.
learn more about that. And this is a program that you also were recognized in 2019. And one of the things that stands out for me, I think about it often, is the long relationships that you have with, they have volunteers that have been there since the beginning
Yes.
and have long relationships with caregivers, which is, you know, we haven't measured that, but we know it's like gotta be, it just
Yeah.
on its
And, you
face
know,
has to contribute
yes.
to caregiver wellness and quality of life.
To
Absolutely.
Eric's question earlier on about things people are looking for, one of the things we know, and I was just looking at the back page of a New Yorker that said loneliness is like smoking 15 cigarettes a day to your health or something like that. And just looking at the connection, you know, there's so many different things you could be evaluating, but the relationships that are developed during respite, the long-term relationships, what a great contributor to caregiver health right there. So we can be so creative here and ask important questions. So
thank you. Did we miss anyone?
I think that's everybody. And well, Jill, of course, didn't introduce herself, but we all know Jill. Hi.
Hi, everybody. I'm Jill Kagan. I'm the director of the Arch National Respite Network. And we're over time, so I want to be respectful of that. And if there aren't any other questions, please note that the applications are due March 1st. If you have any questions, I'm sure Cassandra and Susan would be happy to answer them at any time. You know, if you get, as soon as you get off this Zoom call and you think of a question you wanted to ask, please don't hesitate to reach out to either one of them. I don't know, Cassandra and Susan, did you have any closing remarks?
Well, just hope we get to work with you. I'm very excited.
Wonderful.
Thank you
all for being here.
Yeah, thanks for all your work. Thanks for the work you do every day.
Thank you.
Thank you.
Thank you.
Take care, everyone.
Take care.
Yeah.